So I work in public health in Brighton and Hove City Council. Nigel Sheriff is also here, so this is a collaborative piece of research I'm going to talk about. And this is actually something that's planned for next year, so I'm not talking about results from research, but a piece of research that we're planning for next year. So in terms of what we're looking at, we have done in Brighton and Hove a health and wellbeing survey approximately every 10 years of adults. It's only once every 10 years because it's quite a costly thing to do. So the last one was in 2012, so we had a bit of delay with COVID obviously within there. And for us, these surveys remain the only source of small area data for us to be able to look at inequalities within the city, both in terms of areas of the city and inequalities, but also in terms of looking at equalities and protected characteristics. It's such an important source of information for us. Put in there, we still reference the 2012 findings because there isn't any other source around this. And the evidence from health counts feeds into our local strategies to improve health and wellbeing and to identify and reduce inequalities. It's a really important source for joint strategic needs assessment, and that's a duty both local authorities and the NHS have to produce these looking at the needs and assets of local communities. So it's a vital source around that. And it helps us meet our requirements and consider the Equalities Act in how we commission and provide services to meet the needs of our local population. In terms of the collaboration, so the advisory group is led by the University of Brighton and Nigel Sheriff, so we've got various people, a few here in the audience today as well from the University of Brighton, the medical school, the City Council, and also Health Watch in Brighton and Hove, so a really important partner in terms of involving communities in the research as well. So as I said, we've done this survey approximately once every 10 years. Previous surveys, so public health, in all these previous surveys, we used to sit in the NHS, now it's in local authorities, so a slightly different landscape in how we're doing it. We used to send it as a postal survey, sent to a random 2% sample of adults registered with GP practices. And for this survey, we very much wanted to partner with local higher education institutes to develop our local research collaborations further. So as I said, we previously used to sit in the NHS and we could draw that sample from primary care registers and send out those postal surveys. That wasn't an option for looking at in terms of GDPR for the survey this time, and also in terms of the postal survey, it wasn't either economically or environmentally viable as an option. So we spent quite a long time looking at various options and information governance around them. So sorry to have an information governance on it, but in terms of looking at how we do population surveys now, it was a huge effort. So it was complicated, but actually it's also quite simple. So we did look at various routes. We had to involve lots of our IG and digital leads, our local medical committee and others in looking at how do we actually do this survey. What we are actually going to do with it this time round is ask practices to send text messages to their adult patients to invite them to participate. So it's no information is leaving the GP practice for the researchers, they're not sending the invite, GP practices themselves are doing that, so we've had to go into lots with GP practice around the ICO report and why we're able to do that, and it's not marketing, it's for research purposes, which is very much allowed. Working with practice managers and others, practices don't have a way of generating a 2% random sample of their patients, so actually they suggested we send it to their whole adult population list. For us, that completely changed the possible scale of the survey. Practices will need to run it through mesh so that they're excluding anyone with a national data opt-out. And from public health, we are funding practices in terms of the time it takes to generate those lists, send those messages. To do that, and the costs of the messages themselves are also being funded. So as I say, it's quite a costly thing to do, and there's some additional costs in there, but we're not posting out the surveys. We're also now exploring, Brighton and Hove has a federation of GPs, so that's a membership organisation of GP practices and the PCNs. and actually looking at, they may be able to offer this on behalf of practices, that they run this for them, so that individual practices don't need to run those searches and send those messages. In terms of where we are with our plans, so the survey launches from mid-March until April of next year. NHS ethics approval is almost complete, so we've got provisional approval for that, just with some minor changes, sponsored by the university. And we're currently in the survey development and testing phase. So we've got a draft survey, Healthwatch testing the survey with communities to get feedback on that, looking at cognitive load, how we're presenting it, the routing, wording, etc. as well around that. And we're now in the stage of engaging with GP practices. So that's a significant undertaking to make sure that we get GP practice buy-in into sending out messages. And there's a much wider communication plan as well. So we're looking at things in libraries, bus stops, etc., 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 in terms of wider promotion, because people might not respond to a message through their GP practice for that, or might not be registered with GP practice. So we're also looking at a much wider engagement plan. We've also got an element around supported completion for the survey. So we recognise some people either won't be registered with a GP practice, might not complete an online survey. So we've identified some key demographic groups where we're looking at supported completion, and there's a bit of a mix of routes through which we're engaging with different groups. So Gypsum Roma travellers, families, friends and travellers are involved in supporting that. For example, we've got Arch GP practice who support people experiencing homelessness. We're engaged in how we deliver that in a different way, but also other groups like refugees and asylum seekers, people from lower socio-economic groups or with lower digital access, and older people. So in the main, that will be through convenience sampling. So the researchers are linking with community organisations, with the council and with the NHS to attend events already in place, and will either have pads available that people can choose to complete themselves or support in completion in that. In terms of the areas that we're covering in the survey, so it's quite a broad range of areas, from mental and physical health to lifestyles, so smoking, vaping, physical activity, oral health, alcohol and drugs use, sexual health, but we've also got things around gambling, we've got social connectedness and socio-economic factors, including questions on the cost of living, so we can look at that in relation to people's health. And demographics, so we already had in previous surveys quite a lot of demographic questions, but we've expanded the equalities sections within that this year to look at inequalities posed by different groups, but also hopefully to look at the intersectionality between those. So in terms of the survey results, the analysis plan is in progress at the minute, but the initial summary outputs will start to be available post-June of next year, and the project advisory groups developing a publication strategy and data sharing policy. Obviously this hopefully gives us, if we get really good engagement through GPs and other routes, a really good source of information for future research and exploring within there. So we will be launching the landing page in November and updating that regularly up to and post the launch for anyone interested. Share that through the group once it's launched. And if nothing else, I'll just say, if you live in Brighton and Hove or are registered with a Brighton and Hove GP, please also complete it. Nigel, anything you want to add?
No, I was about to do that plug, but you said so that's great, thank you.